Welcome to another deep dive. Today, we're going to be talking about something I think we can all relate to, colonoscopy prep.
Yeah.
Not exactly, a fun topic,
Right.
but you sent us this fascinating guide from Three Rivers Endoscopy Center
hmm
in Pennsylvania, and it features this new prep option called SUTAB. That's generating a lot of buzz.
Yeah, it's interesting because while colonoscopies are considered the gold standard for detecting and preventing colon cancer,
Right.
the prep has always been kind of a big hurdle
Yeah.
for a lot of people. And a pill-based option like SUSTAB could really change the game.
Yeah, exactly. So less intimidating prep means hopefully more people will actually get screened. It's a
Right.
win-win for everybody. Now, this guide really dives deep into the whole SUSTAP prep process, and I have to say it's pretty detailed. But before we get into the nitty-gritty, can you remind us why this is all so important in the first place?
Well, colonoscopies allow doctors to visually examine your colon,
Right.
look for anything suspicious, mainly polyps. Polyps are small growths that can sometimes develop into cancer. Catching them early means a much higher chance of successful treatment.
So prevention is key here. Now, the guide is very upfront that the prep is often considered the most challenging part.
Hmm.
What is it about traditional preps that people find so difficult?
Well, the older preps typically involve drinking a large volume of liquid
Right.
that, let's be honest, doesn't taste great. And,
Yeah.
and this can be really tough for some people to tolerate, especially those who have sensitive stomachs or difficulty with large volumes of fluid.
And that's where SUFTAB comes in, right?
Exactly. By using pills instead of a liquid solution, SUSTAB aims to make the whole process easier and more palatable, which could lead to better compliance and ultimately more successful screenings.
And for the doctors to do their job properly, they need to see the whole colon.
Yeah, it's got to be clean. Imagine trying to find a tiny seashell
Okay.
on a beach that's covered in seaweed. That's what it's like for the doctor trying to spot polyps in a colon that isn't totally clean.
Oh, I see what you're saying.
So the prep is all about getting rid of that seaweed so the doctor has a clear view.
Makes sense. A clean colon, accurate exam. That's what we want. Okay, so this patient guide walks us through the SUSTAP prep step by step. It's a multi-day process,
Mm-hmm.
starting 3 days before the actual colonoscopy. What's the first thing people need to know?
Well, the guide suggests starting with a light diet 3 days before the procedure. The goal is to make things a little easier on your digestive system. You don't have to completely deprive yourself, just be mindful of portion sizes.
Right.
Avoid foods that are known to be harder to digest.
So like that giant burrito I had for lunch,
Right.
maybe not the best choice.
Probably not the best timing.
Okay.
They specifically recommend avoiding raw vegetables, corn, seeds, and anything with the skin like tomatoes or cucumbers.
Got it. So saying goodbye to salads for a few days.
Right.
What else is on the no-no list?
They also advise against fiber supplements like Metamucil. The whole point of the prep is to clear things out. So
Yeah.
adding extra fiber at this point would be counterproductive.
Makes sense. So 3 days out, we're focusing on lighter meals, avoiding certain foods.
Right.
What happens next in this prep journey?
It's important not to go into the prep constipated.
Okay.
They recommend using a bit of milk of magnesia with plenty of water to help get things moving. Then comes the big day, or should I say the day before the big day.
The day before the colonoscopy, what's the game plan for that?
This is where the prep really kicks into gear.
Okay.
Starting at 7 a.m., it's a clear liquid diet only.
Okay.
No more solid food from this point onward.
Clear liquids. Okay, that means.
Things like clear broth, black coffee or tea,
Yeah.
clear juices without pulp,
Ah.
Jell-O, popsicles without bits. You want to avoid anything that could leave residue
Right.
in your digestive system. And here's a little quirk they say to avoid red or purple liquids.
That's interesting. Why is that?
It has to do with the colonoscopy itself. Certain shades of red and purple can look very similar to things they're looking for in the colon, like blood or inflammation. So to avoid any potential confusion during the exam, they recommend sticking to lighter colored liquids.
No, no. Okay. Better safe than sorry. So clear liquids, only lots of water, and no red or purple.
Mm-hmm.
Anything else we should know about the day before the colonoscopy?
Yes, actually. This is where we'll start talking about the SUSTAB itself.
Okay, let's do that when we come back after a quick break. All right, we're back and ready to dive into this SUTAB prep.
It's 6 p.m. the day before the colonoscopy. This is when things really get going right.
Yes, this is when you start the SUTAB regimen. If your doctor has prescribed an anti-nausea medication like Zofran, you'll take that about 15 to 30 minutes before starting the SUTAB.
Okay. And then it's time for the pills. The guide makes a point of saying to take them slowly, one every 1 to 2 minutes with a sip of water. Seems like they really want to emphasize not rushing it.
Right. The idea is to space out the pills over about 20 minutes to make the process more manageable. It's definitely a different approach compared to those large volume liquid preps.
No kidding. And speaking of liquids, there's more water to drink after the pills, isn't there?
Yes. About an hour after your last pill, you'll need to drink 16 ounces of water over 30 minutes. And then another 16 ounces about 30 minutes after that. So make sure you have your water bottle ready. Okay, so that's a lot of water in a pretty short amount of time. I guess that's why the clear liquid diet is so important. I can't imagine wanting to eat anything heavy at that point.
Definitely not. Now, while we're on the topic of the clear liquid diet, there's a crucial detail for the morning of the procedure that we should mention.
Oh, right. The nothing by mouth rule. Tell us about that.
This is super important. For 4 hours before your scheduled colonoscopy, you cannot have anything to eat or drink, and I mean anything. No water, no gum, no candy, no coffee, nothing.
Not even a little sip. That seems pretty strict.
It's all about safety during the procedure. Anything in your stomach could potentially be aspirated into your lungs while you're under sedation, which can be very dangerous. So they err on the side of caution with this rule.
That makes sense. But what about essential medications?
You can take essential prescription medications with a small sip of water, especially if it's something important like blood pressure medication. However, medications for diabetes and blood thinners require specific instructions, so it's absolutely crucial to consult with your doctor about how to manage those.
Speaking of diabetes, the guide does have a whole section dedicated to diabetic considerations during the prep process. Why is that such a big deal?
Diabetes adds another layer of complexity to colonoscopy prep because of the need to carefully manage blood sugar levels. The drastic changes in diet combined with the effects of the prep itself can make blood sugar levels unpredictable.
So it's more than just adjusting insulin doses.
Right. What's interesting is that the guide emphasizes that the biggest concern for diabetics during the prep is actually low blood sugar or hypoglycemia, not high blood sugar as you might expect.
That is surprising. Why is hypoglycemia a bigger risk in this case?
It's because the prep essentially flushes everything out of your system, including the food that would normally help regulate your blood sugar. And since you're not eating solid food, your body has fewer reserves to draw on. So even if you're taking insulin, there's a higher risk of your blood sugar dropping too low.
Okay, so diabetics listening, please pay close attention to those instructions and talk to your doctor. Now, aside from the diabetic considerations, there were a couple other things in the guide that I found intriguing. For example, they specifically recommend milk of magnesia if you tend to be constipated. What's the thinking behind that?
That's a good point. Milk of magnesia is what's known as an osmotic laxative. Essentially, it works by drawing water into the colon, which helps soften the stool and make it easier to pass. It's a gentle way to kind of prime the pump, so to speak, before the main prep kicks in.
Ah, I see. It's like getting a head start on the whole clearing out process.
Exactly. And speaking of clearing out, the guide also provides some helpful tips for judging the effectiveness of your prep. Have you noticed that part?
Yes. They talk about this clear yellow fluid benchmark. It sounds like the goal is for your output to resemble urine in color.
That's a good way to put it. And there's actually a scientific reason behind it. The yellow color comes from bile, which is produced by the liver and helps digest fats. Even though you're not eating during the prep, your liver is still doing its thing and producing bile. That bile needs somewhere to go, and it eventually ends up in your colon. So if the fluid you're passing is clear and yellow, it means things are moving through efficiently, and your colon is likely nice and clean for the procedure.
So it's like a built-in indicator light.
Precisely. The guide even mentions that you should call your doctor's office if you're still having solid or brown stools the morning of the test. It's better to check and potentially reschedule than to risk having an incomplete exam.
Makes sense. Now, before we move on, I wanted to touch on one more thing that caught my attention.
Yeah.
The requirement for having a driver for the procedure. The guide seems pretty adamant about that.
That's standard practice for colonoscopies. You'll be sedated during the procedure, so it's not safe to drive yourself home. Plus, you might still feel a bit groggy and disoriented afterward.
They even mentioned that the driver needs to stay at the facility during the entire procedure, which they say averages around 2 hours. Otherwise, they might have to reschedule your appointment.
That really underscores how seriously they take patient safety. It's not just about getting you home safely, it's also about ensuring that someone is there to hear the doctor's explanation of the procedure and any findings. They want to make sure you have someone with you who can advocate for you and help you understand the information being shared.
So find yourself a good friend or family member who's willing to be your designated driver and information buddy, and maybe treat them to lunch afterward as a thank you.
Absolutely. Now, I know we've covered a lot of ground here. Maybe we should pause for a moment and let our listener digest all this information before we move on to the final part of our deep dive.
Good idea. When we come back, we'll talk about what to expect after the procedure and explore some broader implications of this new pill-based prep. All right, we're back, and I have to say, we've covered a lot of ground when it comes to this colonoscopy prep with SUTAB. It's definitely a whole process, but it seems like this pill-based option could really make things easier for people.
I think so too, and that's important because if the prep is less daunting, more people are likely to get screened, which ultimately means better prevention and early detection of colon cancer.
Exactly. So before we wrap up this deep dive, I wanted to touch on a couple things. First, how does SUSTAB actually compare to other prep options out there? I mean, is it just easier or are there other advantages?
That's a great question. From what we're seeing in early studies, SUSHAB seems to be just as effective as the traditional liquid preps in terms of cleansing the colon, but there are a few potential advantages.
Okay.
One is patient preference, obviously. Many people just find pills easier to swallow than large volumes of liquid.
Yeah, I can definitely see that. Now, I know we talked a lot about what to expect before the colonoscopy, but what about after? The guide doesn't really go into that. What can people expect once the procedure is over?
Well, that's something to definitely discuss with your doctor, as post-procedure instructions can vary, but generally speaking, you'll likely feel a bit groggy from the sedation, so you'll need to rest for a while. You might experience some mild cramping or bloating, which is normal as your digestive system gets back to its regular rhythm.
So take it easy for the rest of the day.
Exactly, and of course, you'll want to listen to your doctor's instructions about when you can resume eating and drinking normally.
Okay, good to know. Now, you mentioned earlier that making prep easier could lead to more people getting screened for colon cancer. Are there any broader implications to that beyond just individual health?
Absolutely. Colonoscopy screening rates have been historically low, partly due to the perceived inconvenience and unpleasantness of the prep. If a pill-based option like SUTAB can significantly improve the patient experience and increase compliance, it could have a major impact on public health. We could potentially see a decrease in the incidence of colon cancer, which would be a huge win.
Wow, that's pretty amazing to think about. So in a way, this little pill could actually have a ripple effect on a much larger scale.
Exactly. It highlights how something seemingly small can have a big impact when it comes to healthcare and prevention.
Well, on that note, I think we've thoroughly unpacked the world of colonoscopy prep from the nitty-gritty details to the broader implications.
We've covered a lot from the step-by-step SUTAB process and those important diabetic considerations to the potential benefits of this new pill-based option and its impact on public health.
We even got a little insight into the science behind that clear yellow fluid benchmark. Who knew bile could be so fascinating?
It's all connected. And at the end of the day, knowledge is power when it comes to your health.
Couldn't agree more. So to our listener who bravely ventured into the world of colonoscopy prep with us, we hope you found this deep dive informative and maybe even a little bit empowering. Remember, it's all about taking charge of your health and making informed decisions.
And if there's one thing to take away from all of this, it's that colonoscopy prep doesn't have to be a dreaded experience. With new options like SUSTAB, it can be manageable and even, dare I say, a little less intimidating. And remember, talking to your doctor and asking questions is key. They're your partners in this journey. And before we sign off, I want to give another shout out to the Center for Digestive Health and Nutrition. Their website is an amazing resource for anyone who wants to learn more about digestive health, with tons of information, articles, even recipes. It's all there.
So big thanks to them for all the great work they do.
Yes, thank you.
And on that note, we'll wrap up our deep dive. Until next time, stay curious, stay informed, and stay well.